You know, in the practice of plastic surgery, it may seem that we don't have very many tools to affect the costs and economics of healthcare. But in academics, we can always study our actions to analyze these costs, identifying causes and potential remedies. In the March issue of PRS, we're going to look at 3 articles that investigate the economics and costs of reconstruction in plastic surgery. In the first article, Dr. Israeli and his team review the insurance claim of over 800 breast reconstruction flap procedures. In addition to analyzing their outcomes, the authors hope to assess complications and costs. They discovered that nearly all the patients returned at least once for non-complication related treatments. They also discovered that the mean total cost for the procedure plus the follow-up ranged from $35,000 to over $55,000. These costs and the team's result indicate the complexity of flap-based breast reconstruction. How can the healthcare system today and the surgical community benefit from this cost analysis? Read this fascinating study to find out what you can do in your practice. In the next article, Dr. Albornoz and her team investigate recent trends in American breast oncology and autologous breast reconstruction, including microsurgery and bilateral mastectomies. They hope that in their analysis of these trends, they can uncover a link to the recent rise in related healthcare costs. By investigating hospital charges for procedures from 1998 to 2010, the authors carefully calculated that the average cost of autologous reconstruction is about $22,000. Amazing. The costs rise more than 50% for bilateral breast reconstruction and more than 150% in microsurgical cases. Complications more than doubled these costs. Their analysis also revealed a significant reduction in costs when the procedures were performed at so-called high-volume hospitals. To find out how these costs are calculated and what these trends may mean long-term for the economics of breast reconstruction and how you can apply it to your practice, please read this article. In the last article, Dr. Fischer and his team investigate whether or not the epidural use in abdominal wall reconstruction can decrease costs. This team reviewed 134 consecutive patients from a single surgeon. Epidurals were associated with a lower rate of major complications and morbidity. They were also linked to fewer unplanned reoperations and shorter hospital stays. The team concluded that using epidurals can save over $22,000 per procedure. How could these findings affect your hospital protocols? Read the article and it will be very illuminating. Medical costs seem to be spiraling out of control, so it is comforting to know that with solid research we can help identify these cost resources and subsequently cost savings. Reading articles like this in PRS, all of us can become more knowledgeable about the economics of healthcare and the trends that affect all of us in plastic and reconstructive surgery.